good evening to some of you. Good morning as well. My name is Marissa Naidu. I am GAIA Africa's plastics campaigner, and it is my pleasure to officially welcome you and start us off on a very high note for this high-level webinar that is titled Adjusting the Lens on Plastics and Healthcare. Today, I'm not alone. I am joined by Mafoko Pumane, who is the environmental health campaigner at groundWork South Africa, that will be co-facilitating this webinar with me. I would like to invite Mafoko to say hi and welcome you all with me.
Good day, everybody. Thank you, Marissa, and welcome to our webinar today. Marissa said, yes, I am an environmental health campaigner at groundWork, and we're also Friends of the Earth South Africa. Thank you.
Thank you so much, Mafoko. So as more and more people start joining us, please continue to introduce yourselves in the chat, the country you're joining from, as well as the organization that you're from. Please take note that you can listen to today's webinar in French by choosing from the interpretation options at the bottom of your screen. And Carissa is just going to put up how we do this. So if you look at the bottom of your screen, you will see a globe icon, and that will help you navigate between English and French channel. So if you want to listen to this, webinar in French, please do click on the French interpretation. And we continue to welcome more and more people. I can see Karen in the chat. Welcome, Karen. It is a pleasure to have you with us today. All right, so I think we are ready to get into it. Perhaps let us start off with why we're here today and why this webinar has come at such a critical point. So the purpose of today's webinar, before I get into the purpose, I'd just like to acknowledge that today's webinar is a collaborative effort. Whilst it is being hosted by us, GAIA, and Break Free from Plastic Africa, we have also collaborated with our partners, groundWork South Africa and Healthcare Without Harm. And the aim for today's webinar is for us to really take a deep dive into understanding the health impacts that are associated with plastics across the value chain, and to really address the overconsumption of plastics by the healthcare sector, with the vision of demonstrating how healthcare systems around the world, especially in the global south, can actually reduce their reliance on single-use plastics in the healthcare sector. This webinar is most timely since we are celebrating Plastic Free July. So happy Plastic Free July to everyone. And it's GAIA's undertaking to address plastics and healthcare this Plastic Free July. The webinar has been culminated as well in direct response to the increasing influential power that the plastics industry has been demonstrating in shaping policy and public perception, particularly during the INC negotiations for the Global Plastics Treaty. So really today, through this webinar, we are hoping that our experts that we've invited will help us adjust the lens on plastics and healthcare, and also clarify the roles of plastics in healthcare to empower you, our participants, to critically evaluate false solutions and ensure that the Global Plastics Treaty adequately addresses the health impacts of plastics to protect both people and the planet. So with that very strong purpose and expectation that we've created for today's webinar, I am hoping that our experts will really be able to tackle this head on. And having outlaid our expectations, we would love to know what you're also hoping to gain or learn for today. So please feel free to populate the chat and share your thoughts with us as to what you're hoping to gain out of today's webinar. We would really appreciate that. And I will take this time while you do that to go through some of our housekeeping remarks and opening remarks as well. So a few reminders for today's session is to make sure that your full name is displayed on your Zoom account during the event, to keep your microphone muted to avoid disturbing our speakers as they head into their presentations. We also welcome you to engage with our speakers through the Q&A function on Zoom or in the chat, which can be found at the bottom of your screen. And these questions will be answered at the very end in the allocated time. We also invite you again to use the chat box to introduce yourselves as you continue to come in. And also note that this webinar is being recorded both in English and in French, and we will definitely be sure to share the presentations afterwards with you. Lastly, if you face any technical issues or you're struggling to get onto the interpretation for that matter, you're more than welcome to reach out to my colleague Carissa, who is available on tech support. And I think I have exhausted my time talking about everything that the webinar is related to. And at this stage, I want to now invite all of you for a quick photo, if you will indulge me. So if we perhaps could take off our slides, and if we can record this moment. I see 69, now 70 people. And I'm going to invite you all to please turn on your cameras with big smiles as we celebrate Plastic-Free July. And I will ask my colleague Carissa to take a snap of all of us. There's 3 screens, so please bear with her as she goes through each one of them. Carissa, you let us know when you're ready and we'll give you the biggest smile we can.
Ready, thank you.
Okay, awesome. Count us down.
I think we're
Perfect.
good. I got them.
Okay, we've got them all. All right, thank you so much. Thank you so much, Carissa. And again, thank you so much, everyone, for joining today. It's a phenomenal turnout of 70 people, and we're really happy to have you on with us. I'm now going to hand over to Mafoko to introduce our speakers. And yes, let's get the show on the road. Thank you, Mafoko, over to you.
Great, thank you, Marissa, for that amazing warm welcome. I'm going to introduce our esteemed speakers today. First off, we have Leslie Onion, who is the head of Chemical Safety and Health Unit at the World Health Organization. Leslie has over 25 years of experience in fields related to chemicals management, poisons information, and occupational health. She is a senior toxicologist and a researcher. At the WHO, Onion leads the Chemical Safety and Health team. She contributes to the organization's efforts in global chemicals management and pollution prevention. Her expertise and leadership helps advance WHO's mission to protect human health from the adverse effects of chemicals and promote sustainable development. We will also be joined by Aziza Rangwala. She is the Global Green and Healthy Hospital Coordinator at GroundWork. She brings over 6 years of experience working for the Gauteng Department of Health as an Assistant Director for Research, Policy and Capacity Building. Aziza has been involved in policy formulation and managing projects aligned with the Sustainable Development Goals at the national and the National Development Plan in South Africa. We will also be joined by Tracy Easthop, who has kindly sent us a recording of her message. She's unable to join us today. Tracy is founding member and senior strategist with Healthcare Without Harm. For 23 years, she has directed the US-based Safer Materials Work Group of Healthcare Without Harm. She currently directs the global supply chain transformation efforts, and she is currently leading the team for SHIP, a project jointly implemented by Healthcare Without Harm and the United Nations Development Programme. in 10 lower middle income countries, which was designed to promote sustainable procurement in the health sector, to conserve resources, promote ethical supply chains, and reduce the toxicity of materials in health products, as well as reduce greenhouse gases. We will also be joined by Dr. Hectoria Awukia, who is a highly accomplished public health physician and the Regional Quality and Safety Manager at the Eastern Regional Health Directorate in Koforidua. This is in Ghana, with extensive expertise in public health. She also plays a pivotal role in ensuring the delivery of quality and safe healthcare services within the region. Next, unfortunately, we were meant to be joined by John Chweya, who is in Kenya. He was meant to be joining us, but unfortunately cannot due to the current situation there. He's the president of the Kenya National Waste Pickers Welfare Association. Lastly, we will be joined by Ruth Stringer, who has been working with Healthcare Without Harm for over 10 years. Ruth has been coordinating work on waste, but also providing expertise on chemicals, pharmaceuticals, and procurement. She is a member of the International Solid Waste Association Healthcare Waste Working Group. And this is she's also a technical advisor to the Africa Healthcare Waste Management Project that Healthcare Without Harm is leading together with UNDP and WHO. And she advises on waste management policies internationally. So these will be our speakers for today. And without much further ado, I would like to call upon Leslie to take the floor. She will be addressing plastics in healthcare, giving us a WHO perspective. Leslie, the floor is yours. You're still muted, Leslie.
Okay, I think that should be all set, right? You can see my screen,
Yes,
okay? Yeah, so thank you very much for the opportunity to join the meeting this afternoon. I'll be talking largely about the new global plastics treaty that's being negotiated right now. It's coming to an end of the negotiations, but as I'll explain, there's still quite a lot to do in order to really strengthen the health aspects of that treaty, and including those aspects which are particular relevance for the healthcare sector. So first of all, the World Health Assembly, which is comprised of all the ministries of health and the ministers of health, indeed, from all of the countries around the world, they gave us a mandate in 2023 to work to increase our work on plastics, because they were concerned about the production, consumption, and disposal of plastic products, which could be released into the environment, would affect humans, plants, and animal health. And they recognized that more needed to be done, and asked for member states to give their mandate to WHO to scale up its work, including in relation to the new plastics treaty, to make sure that the health aspects of that treaty were appropriately reflected, and also to call upon WHO to provide technical work and support to countries, including the ability to conduct science-based assessments, recognizing that the science in relation to the effect of plastic pollution on health was very rapidly developing, including the impact of microplastics, and they voiced their concerns in that regard as well. So as WHO started to be involved in the plastics treaty negotiations, and to give support to member states, and to guide member states in understanding the aspects of the plastics treaty related to health, we identified three key principles. One, that the Plastics Treaty should be pursuing the highest attainable standard of human and environmental health, that that aspect should be a core part of the treaty. The treaty shouldn't just be taking having a focus on littering or plastics in the marine, but really we should be looking at making sure that the treaty supported people's attainment of the highest standard of health. Secondly, that the plastic pollution contributes health hazards in a number of different ways. There's risks and exposure to all stages of a plastic's life cycle. That is the production of that plastic, the use of the plastic, as well as the disposal of the plastic, and the chemicals and additives in the plastic, as well as the plastics and microplastics themselves, they all need to be considered, particularly reflecting the fact that those are being increasingly found in the environment and in humans. And we note that a lot of research being published nowadays on the microplastics and the impact on human health, for example. Thirdly, that we should be ensuring safe and effective health products that are of good quality, affordable, accessible, and appropriate to those that need them. So that the Plastics Treaty should not be inadvertently interfering with that objective, which is obviously a core public health objective. So, but not only should it not be interfering with that, achieving that objective, it should support that objective as if possible as well. So when we're looking at the text and how it's evolving, and it is evolving over time, and the last negotiating sessions at the end of this year, we notice there's still quite a considerable room for improvement. Firstly, that the text as it stands at the moment could be further strengthened to reflect those health aspects and key principles that I mentioned earlier. So to really recognize that we're talking about health and environment, not just environment. And a particular concern is that the text at the moment includes a blanket exemption for medical uses. And we feel, and we're glad that a number of countries and ministries of health also support this idea, that going for a blanket exemption in this new plastics treaty doesn't really recognize the huge innovation that's taking place in the healthcare sector. And certainly it's considering the high use of plastics by healthcare, it wouldn't really be achieving the objectives it's setting out to do if it exempt the medical sector from the application of the treaty. So that's another area of focus. So rather than exempting plastics from the treaty, we'd like to see the treaty recognizing healthcare as a special sector or having special considerations, and including approaches for sustainable procurement and waste management. Both of the procurement and the waste management are particular challenges for the healthcare, but again, there's lots of innovation happening in that area. Secondly, another key area for strengthening the treaty is to promote the idea or the principle of health equity, to make sure that the treaty protects against the disproportionate impact that plastic pollution has on Indigenous and vulnerable communities, supporting a right to clean environment, a right to health, and other rights-based approaches, as well as a One Health approach, which recognises this intersection that we see between environment, animal health, plant health, and human health. And thirdly, we see there's lots of opportunities in the proposed treaty text for further aligning the treaty with expertise and resources, not only in WHO, but also within the health sector, in ministries of health, and in the healthcare industry, in hospital settings, and so on. So we want to see all of those resources being leveraged, and not to reinvent the wheel on different issues. And in this regard, we see there's a lot of scope for improvement about the transparency and mandatory disclosure about health risks, and what chemicals are in plastics, so that we need to see transparent labeling and a really an approach which guards against claiming that vital information to protect health is confidential. So we want to guard against that. for participation of WHO experts, and WHO experts are not only staff experts, but more importantly, those experts that engage in WHO networks and processes on a whole range of issues to ensure an independent and quality scientific support for the treaty. We also see that there's a lot of different points of alignment with other health processes and health treaties. And an important one of this is the WHO Convention for Tobacco Control. We know that cigarette butts, for example, are amongst one of the most widely littered piece of plastic that we see in our day-to-day lives. And we recognize that by stopping smoking, we can therefore have a huge public health impact, as well as stopping that littering of plastic around our environment. So as we look for these co-benefits between health and the plastics treaty, as well as using existing guidance and technical standards and initiatives for treaty implementation. So a lot of areas where we can still improve the text as it's being negotiated. The last session of the negotiations took place in Ottawa in April, and there was a lot of good progress made at that meeting. A lot of the text needed streamlining where there were multiple options on the table, but there has so far been very limited negotiation on the specific text. So there's many opportunities for key aspects for health to be negotiated in a very positive way and strengthened. There remains quite a disparity of views amongst negotiators, particularly targets for reduction of production of plastics and the listing of problematic chemicals in plastics. And we feel it's very important that health is not seen as a negotiating chip, but again, we want to see health at the core of the treaty, not just an added addition. So far, there's been limited opportunity for parties to put forward specific text amendments, but there is a lot of opportunity between now and INC 5. We see an increasing presence of very influential observers and influences, a strong role for Indigenous groups, waste pickers and the youth, and we hope that the healthcare professionals will be increasingly seen as these strong influences as the text is being finalised. So we want to see a stronger health voice in the delegations and a role of the health sector in implementation of the treaty, such as through national action plans. We note that we need to protect misrepresentation on a number of fronts. And I see in the image I put on this slide with some of the posters that we saw being displayed by the plastics industry at the convention, very much promoting that plastic saves lives, that plastics help us with our food supply. All of these things are true. We also need to make sure, though, that they're balanced also with information on the potential harm, and we don't get misrepresentation of other important views, such as those of WHO. I mean, I heard a lot of misrepresentation of our position at the last negotiations, such as WHO doesn't think that microplastics harm us, and that WHO doesn't think there's any risk of plastics. Well, this is not true. As I said earlier, the World Health Assembly, which is our highest decision-making authority, set out very clearly in their resolution that they were concerned about the impact of plastics and microplastics on our health. So we all need to work together to make sure that the health voice is as strong as possible. So my final slide is just some points that we are working on ahead of the next INC, the negotiations, which will be in the Republic of Korea at the end of November. We're in the process of publishing a quick guide on the different health aspects of the treaty, and we've just have new treaty text published last week, so that we're all can focus on that in good time ahead of the negotiations. But we think it would be useful for a number of delegations, hopefully all delegations, to have a quick guide on the health aspects of which parts of the treaty could be further improved. we hope that we'll publish that in the coming weeks. We're also in the process of organising a sort of preliminary workshop on climate resilient and environmentally sustainable health services and supply chains. This is planned for October, and we hope that this will also include plastics, other toxic chemicals, as well as the climate aspects of healthcare service provision. And we hope to include in that and document and disseminate case studies from countries and partners, not only regarding reduction of greenhouse gases, but also chemicals of concern, including plastics. So we hope that perhaps some of the case studies you'll discuss this afternoon could be reflected at that workshop and in other documents that we hope to produce. And amongst these, we think it's useful to produce some more fact sheets about existing health regulatory processes, about medical device registration and so on, to show delegations that these aspects are already being taken care of by the health sector, but that they need to be very much lined up and connected with the treaty. So we look forward to continued engagement, and we would love to participate in webinars that partners do, as well as seek your participation in our webinars. And we hope to continue the conversation in the next few months leading up to the final session of the negotiations in November. So once again, thank you very much for the opportunity to join this webinar this afternoon. Thank you.
Thank you very much, Leslie. The WHO messaging is quite clear as far as the need to avoid blanket exemption for the health sector. Thank you for sharing your insights on the need to promote health equity as well as rights-based approaches. Leslie unfortunately has to leave us at this point, but please feel free to type your questions for her in the chat, and we will forward those to Leslie. Thank you, Leslie. We will be moving on to our second speaker, Aziza Rangunwala, who will be addressing the need to understand the landscape and reality of healthcare systems in Africa and its reliance on plastic. Aziza, you have the floor. Please share your screen. It's currently still on presenter mode, I believe.
Okay, let me just switch that. Good afternoon, everyone. Okay, I think it's on full screen now.
Perfect.
Yeah. So thanks for the introduction, Mafoko. I'm the Africa Regional Coordinator for Global Green Healthy Hospitals. And I'm going to just give a quick overview about the landscape and reality of our healthcare systems in Africa and its reliance on plastic. And I think our story is also part of the bigger global story, but I think they are also very much WHO Afro report. There's a few basic tenets of how we measure health systems performance. And there's 4 things like access to health and health-related essential services. There's also the quality of demand of health and health-related essential services like usability, how many people are utilizing primary health services, for example. Then there's also the resilience in the provision of essential health and health-related services. And the last part is very important, seeing in the middle of climate provisions can remain resilient. Now, in the context in Africa of our Sustainable Development Goals, we do have the lowest life expectancy in our region. And this is due to several factors. And several of these health determinants are like your social, structural, and political determinants of health. Now, we do have very much, unique challenges in Africa is usually attributed to resources. There's obviously a larger historical context of how we got where we are, And plastics are relatively new in the landscape of how health has always been structured. Relatively new and old. Let me just move over to this one. So global workforce shortage, and that's not unique. And we have that issue in South Africa and in other African countries as well. Now, we have had a wide range of medical devices and applications since the 1930s already. Due to global markets, I think our health systems also assimilated plastic with the global markets as well. Now, plastics were first introduced because they said they were relatively cheap because of cost, also because of convenience, because they were light to transport, and also attributed to hygiene. And hygiene is usually what is mentioned in a lot of times of why and how plastics entered the healthcare sector. There's no compelling evidence for plastic being more hygienic. A lot of the research was done by plastic manufacturing companies, determining, and that tells you a lot about the bias in the research when it comes to hygiene. So the issues that we have in our hospitals and health facilities is that there's a lack of reusable equipment and sterilization equipment, and also consumables. So getting consumables is one thing, but having, for example, an autoclave to sterilize them or to have the right chemicals to sterilize them is also another issue. I think in general, when we look at our energy poverty on the continent, this has probably contributed to a heavier reliance on plastic. So the plastics found in your syringes, your IV tubing, your surgical gloves, your prosthetics, theater packaging alone, can give you mountains. Everything that is single wrapped for sterility, in those blue plastics that create a mountain, we find quite abundantly everywhere. Now, globally, they say that the 30% of healthcare waste is actually plastics. And I think these statistics were from pre-COVID. So that has probably gone up quite significantly. And I think there's other speakers would probably go more into detail about that. So a third of the waste in ICU and anesthetics are also plastics. And interestingly enough, studies have shown that bacteria can survive up to 40 hours in plastics and in rubbers used in medical equipment. So this has been done on PVC, your polyurethane, and your nitrile. So infection prevention, plastic lobbying or plastic marketing guideline, and I think our high incidences of HIV and AIDS in Africa has also pushed a lot of single-use plastics because of that angle for infection prevention control.
Aziza, if you
what happens to your plastic?
Sorry to interrupt, yeah? Aziza, yes, you are freezing quite a bit. Perhaps I can suggest you switch off your camera so we can hear you better. Thank you.
Okay, I've switched it off. Let's see if we can hear you better. So your healthcare waste, your plastic does become healthcare waste. And I think the issue with plastic pollution comes where, just in general, healthcare waste management, the elements there are your segregation, waste classification, waste minimization, waste containerization, color coding, labeling, signage, handling, transport, storage, treatment, and final disposal. Oftentimes with waste management, just also in general for anyone in a non-waste health setting, waste is seen as you throw it in the bin and it just has to disappear somehow, right? But there are so many steps in how waste is treated and how waste is managed. And previously, boxes were used, but then to save the trees and to save paper, we moved over to reusable plastic containers, which we need to determine which one is better than the other one, right? And a lot of the healthcare waste is incinerated. And incinerating plastic has a lot of byproducts when it becomes waste. So the dumping of healthcare waste into the earth and oceans adversely affects the health of vulnerable communities. And these incinerators do not bank on any calorific value of the plastics. They just cause air pollution. And they undermine global health equity and our major public health issue. And some incinerators are not compliant, to ensure air quality in those regions. So the hospital that has an on-site incinerator is incinerating plastic. And when you incinerate PVC, there are even more harmful products from the incineration of PVC. So I think when it comes to healthcare waste management on our continent, that plastic pollution is directly linked to also air pollution. And we're looking at alternative treatments. And even when you're looking at alternative treatment of waste, you'll see the blue. The blue is your natural gloves. The red is your plastic liners used for healthcare waste management. So when we look at plastic from, plastic, being manufactured down to plastic, trying to break down plastic, it's a very difficult material to be rendered unrecognizable. The other healthcare waste streams are rendered unrecognizable, and then it can go to a regular landfill site. But we know that plastic also has, more chemicals that leach into the groundwater, etc. So the plastic here was done with alternative treatment technology, which is frictional heating and shredding as well. So when we say that hospitals and healthcare systems need to do no harm, we need to look at how we can integrate our environment and health policies, including sustainability strategies with built-in ethical considerations. Because like I mentioned earlier about how the cost and plastic seen as something that's cheap, that cost is externalized to vulnerable communities. Oftentimes, these incinerators are not are near vulnerable communities where people live and affect vulnerable communities' health and well-being and quality of life. Now, when we're looking at moving from incineration to non-burn technologies, that's also an important thing, looking at non-burn technologies for when it is waste. When we're looking at how waste is treated, the reuse, reduce is more important than the recycle, because recycling is often used as a scapegoat for how we could sort out the plastic crisis in the Anthropocene. So we also encourage the use of mercury-free medical devices as well, because of incineration being so popular on the continent. And when we're looking at those waste, healthcare waste steps of segregation, one of the first steps of healthcare waste management is segregation. The segregation is quite difficult in healthcare settings. Oftentimes we find that segregation is not done adequately. Healthcare waste management is not done adequately, as healthcare service providers, do not give consumables that are for the different waste streams, your infectious waste and your sharps being separate from your plastics, for example, because there are always concerns around needle sticks and people not segregating after plastics have been thrown away already. And it's a responsibility and duty of healthcare workers to think about the oath that they took about doing no harm and the hospital not being seen as a polluter. So I find that there's a misalignment between waste generation practices in healthcare and also the ethical obligation of the profession to do no harm. And we're basically seeing how we suffer the consequences of all our supply chain decisions, down from the cafeteria, to the ward, to the theater, where operations take place as well. So when we look at our health system on the continent, they're both equally sick as the patients are. So just to end off and just to summarize, I think we need to look at critical supply chain implementation and maintenance, your extended producer responsibility of how we can do health differently, and look at cost savings. I think moving away from using excessive use of plastics will also save costs for health facilities. And that just to say that climate action is part of healthcare sector's obligation to protect health. I'll end there. Thank you.
Thank you so much, Aziza, really reminding us of the health sector's commitment to doing no harm. And thank you for ending off with suggestions and direction on the need to implement circular supply chain management. Folks, please feel free to continue to type your questions for our speakers in the chat, and we will have a question and answer session at the end. Thank you, Aziza, again. I will hand over to our next speaker. This will be Tracy Easthop. Tracy could unfortunately not join us today, but she kindly recorded her presentation for us, which will look into unpacking the health impacts of plastics across the value chain. And this will be giving us a global perspective. Can we please have Tracy's recording?
Thank you for inviting me to speak today. I'm delighted to be with you. I want to emphasize a few points. First, that healthcare is contributing to the unsustainable burden of plastic pollution, and the problem is projected to get worse. That manufacture and disposal of plastic releases toxic chemicals and greenhouse gases, harming people and the planet and creating a global health crisis. And although plastics are widely used in healthcare, they can be reduced and detoxified, and many health systems are already showing the way. The Plastics Treaty represents a critical opportunity to improve health and protect the planet, and healthcare has an important role to play, both in reducing its own plastic use, but also in making the case for broader change. While plastics have emerged as an indispensable part of medical care because they are lightweight, durable, and can be made sterile, it's also clear that plastics are responsible for significant harms to human health, the economy, and our environment. The global medical plastics market is forecast to increase from $26 to $41 billion in the next 5 years, a 10% compound annual growth rate. This explosive growth is driven primarily by the demand for single-use medical devices. PVC, a problematic plastic, is still the most widely used medical plastic. Part of what is driving the increase in single-use plastic is a perception that they can improve infection prevention. Medical experts are starting to challenge that idea. In this article in the Journal of the American Medical Association, the authors conclude, quote, for certain medical devices, single-use disposability may be the best solution, but broad-scale, unfettered, and irrational adoption of disposable items in the name of infection prevention is harmful, unsustainable, and unacceptable. We know that hospitals in Africa and across the global south have not escaped the increased use of plastics, particularly single-use plastics. Before the onset of the pandemic, Africa produced an estimated 282,000 tons of medical waste each year. During the pandemic, many countries reported increases in medical waste as high as 5-fold. Plastic makes up between 22 and 83% of the healthcare waste stream, depending on the region, facility, and department. The huge increase in single-use plastic during the pandemic didn't just generate mountains of waste. It was also responsible for a big uptick in greenhouse gases. One study estimated the additional personal protective equipment used in healthcare in England alone during the first 6 months of the pandemic added an extra 1% to the nation's carbon burden. The greatest contribution was from gloves, aprons, face shields, and surgical masks. But researchers also found they could reduce the environmental cost by 75% through a combination of strategies, including reducing unnecessary glove use, switching to domestic manufacturing, using reusables where possible, and optimizing waste management, all while maintaining safe levels of protection for staff and patients. Even without a global pandemic, plastics use is projected to grow at an unsustainable rate, quadrupling by 2050. Single-use plastics account for 35 to 40% of current production. This percentage is higher in healthcare. Single-use plastics represent the most rapidly growing segment of plastics. A lot of that plastic is ending up in the global south. Africa is responsible for only 5% of plastics production and consumes only 4%. Yet this study estimates that the US alone exports 1 million tons of plastic waste per year, largely to the global south, including Ethiopia, Ghana, and Senegal. More than 70% of that waste is not recycled, but rather discarded. The amount of waste recycled is abysmally low everywhere because most plastic cannot be recycled, and many places lack the infrastructure to recycle. All of this plastic pollution is creating a global health crisis. A study released earlier this year by the Norwegian Research Council estimates the number of hazardous chemicals associated with plastics is much higher than previously thought. The report found more than 16,000 compounds are used or unintentionally present in plastics, and less than 6% of those chemicals are subject to global regulation. Astoundingly, for 66%, we have no hazard information. More than 3,000 chemicals of concern in plastics are unregulated. The authors point out that this complexity essentially means there can be no effective regulation. Note that these chemicals don't just stay in the plastics. Communities and workers are exposed during production, and once in products, these chemicals can leach out, contaminating people, patients, and the environment. Recycling of plastics can recirculate these hazards into new products. Incineration can release these chemicals to local communities where plastics are burned, and improper disposal also releases these chemicals to the environment. There are peer-reviewed studies demonstrating health effects at every stage of the plastics life cycle, from extraction in coal mines and oil and gas fields to the many stages of production, and finally to disposal. Waste and recycling workers and communities surrounding these facilities also suffer health impacts. The adverse effects are not evenly distributed. They disproportionately affect poor and marginalized populations. Even if you don't live next to plastic production or disposal facilities, we are all exposed. Plastics release toxic chemicals during use and disposal, including additives and monomers. Biomonitoring surveys in the US document population-wide exposure to these chemicals. For example, the CDC's National Biomonitoring Program finds bisphenol A and phthalates, two compounds commonly used in plastics, in the urine of nearly all people tested. Children ages 6 to 11 years had the highest levels, followed by adolescents aged 12 to 19 years. Those chemicals found in every person tested, including children, are associated with a multitude of health impacts, shown on the screen. But this is just two of the thousands of additives in plastics. Other additives have been associated with a very long list of impacts. Exposure to chemicals of concern in plastics also costs the world's healthcare systems, according to a study published this year. The researchers looked at just one broad endpoint, endocrine disruption, and at just 4 classes of chemicals. They found exposure to these chemicals is estimated to cost the United States $250 billion in increased healthcare costs per year, or 1.22% of the gross domestic product. Chemicals of concern in plastics can also threaten patient safety. For example, PVC plastic requires many additives to give it properties like flexibility. Plasticizers used in medical devices have been demonstrated to leach from those devices and result in direct patient exposure. Many government agencies have concluded that some patients are likely to be exposed to potentially unsafe amounts of the plasticizer DEHP while receiving medical care, including sick infants treated in neonatal intensive care units. Substituting PVC and DEHP with safer alternatives is part of what is needed to reduce the toxicity of plastics in healthcare. It's not just the chemicals in plastics that pose threats to human and planetary health. It's also the micro or nanoplastic particles that are released when plastics break down. Microplastics and nanoplastics have been found almost everywhere we've looked, in the air, in soil, and in clouds, where they can affect cloud formation and then fall out to Earth as plastic rain. They are in our drinking water and in the liquids in plastic water bottles and cups and in food packaged in plastic. They are found in nearly every protein source tested and even non-meat-based alternatives. As a result, they are found in all of us, in many organs of the body, and in bodily fluids. The same plastic found in plastic bottles and cups is found in the placenta that holds the developing baby. We're just starting to learn what exposure to microplastics does to our health. Animal models show a variety of toxic effects, including lung inflammation, insulin resistance, neuro, reproductive, and developmental toxicity, and in one important human study, in the New England Journal of Medicine, researchers showed that surgical patients who had a buildup of micro and nanoplastics in their arterial plaque had a 4.5 times greater risk of heart attack, stroke, or death from any cause in the 3 years after the surgery than those who do not have plastics in their plaque. Plastics are also linked to climate change. Greenhouse gases are emitted at every stage of the plastic's life cycle, from extraction to disposal, including incineration. Plastic production is responsible for more greenhouse gases than is generated by the country of Brazil, and the numbers are only projected to grow. Greenhouse gas emissions from plastics could reach 10 to 13% of the entire remaining carbon budget by 2050, according to one analysis. Emissions from the plastics life cycle threaten our ability to meet global climate targets. There is an alternative to unfettered plastic use. Healthcare Without Harm promotes a waste hierarchy focused on rethinking, redesigning, detoxifying, and eliminating unnecessary products as a critical first step in addressing the plastics crisis. We must first eliminate unnecessary plastic items and avoid single-use plastics, and use the least toxic plastics to protect health and to avoid continually recirculating hazardous chemicals. The types of plastics that cause the most significant environmental and human health damage should be phased out. Packaging should be reduced and reused to the extent possible. Where plastics are needed, they should be designed to be reusable and reprocessable, and recyclable plastic must not contain chemicals of concern. Recycling should meet a high standard using local infrastructure. Recovery and disposal are last resorts for all materials. All false solutions should be avoided, including incineration, waste to energy, and chemical recycling. Healthcare Without Harm has created toolkits and reports that provide a roadmap for health systems that want to take action to reduce and detoxify plastics at your facilities. There are innovators in plastics reduction and detoxification in countries throughout the world, and innovations in nearly every department in the hospital. There are also alternatives for many high-volume products. We already know how to redesign, reduce, and reuse, and to detoxify and recycle what we must continue to use. But all of this activity won't be enough if we continue to produce plastics at the current rate. We need to address the plastics crisis with global policy. The UN Environment Assembly passed a historic resolution in 2022 to develop an international, legally binding instrument to end plastic pollution. Formal negotiations began in November of that year. The ambition is to complete negotiations in November in Korea. Healthcare Without Harm has been involved in treaty negotiations from the beginning and prepared documents highlighting the urgency of action on the issue and outlining key principles that should guide treaty negotiations. We believe that the health of people and ecosystems must be at the center of the treaty. However, some governments have proposed that the health sector be exempted from the treaty. In response, Healthcare Without Harm is leading a campaign to challenge this idea. We circulated a global sign-on letter from health professionals urging delegates to craft a strong treaty that does not include a blanket exemption for the health sector. An exemption is inconsistent with the health mission of the sector, and it would stall momentum and discourage innovation for plastics reduction, reuse, and redesign. An exemption would also be contrary to the growing global movement for sustainable healthcare. Instead, the letter urges special consideration to assure the continued safe and reliable provision of care. The letter also calls for a just, ambitious, and equitable treaty that respects human rights, limits the production of plastics, prioritizes detoxification, and requires transparency of information and consideration of the full life cycle of plastics. The letter was signed by groups and individuals representing more than 6 million health professionals globally from 75 countries, including a number of African countries. There is an urgent need to act. As the Director General of the World Health Organization said recently, if the Earth were a patient, it would be admitted to intensive care with a fever, its lung capacity compromised, and its water, its lifeblood, contaminated. This is a critical moment for health professionals to influence the direction of the treaty and the way in which the world will address the plastics crisis. We urge you to get involved in the effort to reduce and detoxify plastics at your facility and push for policies at all levels to address the plastics crisis in order to protect all health and life. Thank you so much.
We would like to thank Tracy in absentia for the strong message, really foregrounding the health impacts of plastics, especially chemicals in plastics, and her ending off calling upon health professionals to participate strongly in messaging and the plastics treaty. Please continue to pose questions to our presenters rather. And I'm going to introduce our next speaker, who is Dr. Hectoria Awekia from Ghana. And she will be also continuing to unpack the health impacts of plastics across the value chain. And as a healthcare professional, she'll be giving us her perspective. Dr. Awekia, the floor is yours. Thank you.
Thank you. Good afternoon, everyone. Please, can you see my screen?
Yes, we can. If you could possibly put on presenter mode, that would be great.
Sure.
You're welcome to be on video as well, if you're able to be.
I'm unable to, so.
Okay, no problem.
All right. So good afternoon, everyone, and thank you so much for the opportunity to be on this call. And my name is Hectoria Awekia, and I'm a public health physician with the East Regional Health Directorate of Kufuridua, to be precise. And I want to say thank you to all those who have presented before me. They have made my work very much easy this afternoon. They've taken care of most part of it, and so I'll just go straight to sharing a bit of my perspective as a healthcare worker. Before then, like they have all said beautifully and clearly, there is a global demand and there is an increase in the production of plastics. We have all seen how it affects our health directly and indirectly, and there is literature to show all that they have said and all that we are witnessing from each one of us, our own perspective. So from the word go, we have realized that the production throughout the life cycle of plastics is destined to cause trouble for us, not only as human beings, but the environment and even human and animal health. And so when it comes to the impact of health, it is the impact on one health, on the environment, on human and the animals. And it's very important for us to appreciate that plastic production and its usage has a very huge impact on climate change, and it is what is really causing most of our problems right now. So plastic contribution to climate change cannot be overemphasized and cannot be played as a little contributor. It's a very huge contributor. So I just wanted us to look at my perspective as a healthcare worker in a developing country like Ghana, how we get exposed to plastics that contain all the various chemicals and additives that expose us in one way or the other. So on a normal day, when you enter any home in Ghana, you will find some of this that I've shown on the screen. So we have our palm oil, which many of us cannot do without. It is an oil that we use for almost all our diets. And when you go to the production site, what is happening is that these containers are containers that are produced through recycling. So they pick our plastic bottles, they pick our plastic water sachet rubbers, and then they mold them, they melt them and mold them into these bottles that or gallons, as we call them here in Ghana, where they are used to serve, to serve this palm oil. This palm oil is boiling hot. Then they pour it directly into these containers so that it will sit there and cool before they now bring it onto the market. And looking at the fact that they pick the plastics from all over, it is not labeled, you don't know what is in there. And we know, or we have a suspicion that these may contain chemicals and additives that are impacting negatively on the health of everyone who is exposed to these oils one way or the other. We also have a common oil, shea butter, that is also processed and served into these plastics, single-use plastics. And when it cools out, it becomes hardened a bit. But at the time of production, it is poured hot into these single-use plastics. So you can imagine what goes in there, the leaching and all that, all those chemicals into this oil that we use for cooking, we use for bathing, as pomade for our hair, or some of us even use it for our body. When you go into any home, you will find these sachets or bottles stuck somewhere in the house, because our water is in these sachets or these bottles, and we hang them. After we finish drinking, we pack them somewhere, we get them into the landfills in our communities. Then of course we know what is happening in the healthcare sector. Aziza has gone through that extensively. Everywhere we are talking about infection prevention and control. And one of the things that has come to stay is single-use personal protective equipment. So the gloves, we use them, we don't use them again on another patient. Sometimes even on the same patient, we use multiple gloves because we want to prevent infection. But as we all know, some of these actions are harming other aspects of our lives. We also talk about the medical devices, which we've just mentioned. Then the wrappings of the medications, the wrappings of equipment, everywhere in our health sector, most of it, we are using single-use plastics. And the risk of leaching, the risk of the fact that when it's decomposed or when it's put out there in the landfills or incinerated, their inability to decompose, also causing some risks to the people that handle them directly and indirectly out there in the landfills. So we speak about repurposing, where I mentioned earlier, the bottles are picked, they are melted and used for one other thing or the other. We talk about recycling, approved recycling waste and unapproved recycling waste. We talk about open dumping, and we even talk about burying. When you go to many homes in Ghana, most of us will bury our waste because we don't want it to go to the municipal landfills, or because we don't want to pay, or we don't have the ability to pay, the means to pay for the companies to come and pick our waste. And so we prefer to dig a hole behind our house somewhere or in our garden somewhere and then bury our waste. And all these, as we have learned this afternoon, are creating problems for us directly and indirectly. We have some of us having our waste ending up at the landfill. Some of us even burn them openly, open burning at home. And in the health facilities, we have incineration and burning ongoing. The thing or the issue we have right now is that many of the incinerators that we have in our health facilities are not up to standard. We call them defunct incinerators. They don't have the kind of ability to burn everything so completely and to an extent that the amount of pollutants that come out of them is really minimized. So when we are having incineration, it's just like open burning most of the time. Like there's a lot of pollution, especially to those in the communities. And we know that these pollutants also have the ability to travel far and wide. So like Tracy mentioned in her presentation, even if you are not near the place where the burning or the incineration is happening, you still stand the risk of you getting some of those pollutants in your environment and you inhaling them, having contact with them, because they will travel either in the water or in the air to wherever you are. We have some of the chemicals that have been mentioned. We have the bisphenol A. We have the fact that bisphenol has a high ability to leach into products when it is added in those products. So we have microplastics that also have the ability to leach or move into water sources. And so it's mentioned that it's found in our water, it's found in our food, whatever that we do, wherever that we are not immune to these pollutants, and we are exposed to them every day, one way or the other. We also talk about grounds for breeding mosquitoes. Some of these plastics, before they are decomposed or before they burn, just little collection of water, they serve as a ground for breeding mosquitoes. Mosquitoes really don't need so much water for them to lay their eggs and to breed. And so they also somehow also tend to be sources or grounds for mosquitoes and other insects to breed. And as we are talking about One Health, we are talking about emerging and re-emerging of diseases that initially we would have said we no longer have to worry about. In recent times, we have heard in the news since the beginning of 2024 how dengue fever is now a threat to all of us. And even Ghana has joined the league of countries that have reported dengue fever. And my own region, in the eastern region, we have reported 9 cases that we are currently dealing with. And all this is because we are contributing one way or the other to destroy the climate and make it easy for these mosquitoes that were hitherto somewhere in the forest to come close to us and cause us many of the problems that we are talking about. So I want us to look briefly at some of the literature out there. When you search the literature, you find that plastics, the impact of plastics on health they are numerous, but I brought these few points for us as a point of discussion. So we have the carcinogenic effect. If you read literature, there's a lot out there, but I quoted Binkoff et al., where they talk about the carcinogenic effect in terms of prostate cancer, breast cancer, and most forms of cancers that we know people are currently battling with. And we have the fact that plastics also have the ability to disrupt estrogen, and so you tend to have diseases that are caused by estrogen disruption. We have hematologic biochemical markers alterations leading to conditions such as atherosclerosis, increase in hypertension, increase in strokes, and all these cardiovascular diseases. We have the inflammatory effects that plastics can also cause, either by mere presence of the microplastic itself, or even the chemicals that they produce that find their way into our lungs or into our bowel. And so we have increasing numbers of lung diseases, including asthma and chronic airway diseases. And we have bowel inflammatory diseases. When I was a medical officer many years ago, when I started work some time back, having diagnosing someone of lung cancer, asthma, inflammatory bowel disease, they were really not common. But these days, the story is different. Every day, you are diagnosing people with prostate cancer, you are diagnosing people with diabetes mellitus, stroke patients are coming in left, right, center. And so it's not business as usual. It cannot just be that these things are happening. We really need to open our eyes that something is really wrong. We are contributing somehow to the situation. It's not only the stress, but also these plastics that we are now learning about their effect. And so we really need to rise and do something about it. We have the other bit of contact with plastics and its byproduct causing irritation and disruption of our normal skin function, leading to increased risk and incidence of skin diseases and skin irritation. So from where I sit as a medical officer in the Eastern Regional Hospital that I've served and worked for the past 10 years, this is what I see. So clearly, many of our plastics in Ghana are not labeled. So we are not able to tell which one contains bisphenol, which one does not contain. Only a few of the plastic products that we buy outside or we have access to buy are labeled with bisphenol free. And many of them, those that label will say it is free. But as to the other additives, nothing is mentioned about them. And so those of us who know a bit would want to go in for the bisphenol free items. But how about the polyvinyl ones? So nothing is said about those ones. So in the clinic, like I mentioned earlier, I want us to look at the trend of prostate cancer in the Eastern region since 2023 to 2013 to 2023. So we have an increasing incidence or increasing number of patients turning up in our facilities across the region. This is not only from one facility. In 2018, there was an error in the data. That is why it's 0, but it was never zero. So if you draw a straight line across this, you realize that there is an increase in the number of prostate cancer. Personally, I know about 3 patients or 3 people, family members and friends that have been diagnosed of prostate cancer. 10 years ago, 20 years ago, prostate cancer was a rare kind of cancer in Ghana, at least from my side. But now it is there. We see it every day. They are in our facilities right now. They come in for blood, they come in for pain medications, they come in for psychological support, they come in for palliative care. Prostate cancer is now so common. And the question is, why is it now so common? Could it be the carcinogenic effect of these plastics that have become so rampantly used in our communities and even in our healthcare? Then how about strokes? Stroke has also become an everyday condition. I have even lost recently, I lost my father-in-law to stroke. And he is not the only one. Many of our patients are coming in with strokes. It was never like that. Stroke, before someone will come down with stroke, I mean, the person should be 50 and 60 and above. But now we have 40-year-olds. We even have as young as 30-year-olds coming down with high blood pressure or severe high blood pressure. And then many of them also coming down with stroke. So we really need to ask ourselves, what is happening? Could it be the chemical effect of these plastics? Because clearly literature has shown that they can contribute to these plaques in the blood vessels, and in the end, some of the consequences are strokes and cardiovascular diseases. Then we talk about asthma. Asthma is also something that has become so rampant in my community and in my everyday practice. So here we are, we have this little boy. This is my own son. We do not have a family history of asthma. But when this boy was delivered, a few days later, we started experiencing some respiratory problems. And then the diagnosis became, okay, it's bronchiolitis. You grow out of it by the age of 2. And we're on and on struggling with breathlessness and all. And then by the age of 4, he was diagnosed as asthma. Even as I speak to you today, he has had an asthmatic attack and he is currently in the hospital for care. And so we cannot just say that it's just happening because we don't have a family history. So where is it coming from? We don't live in a community where we say that, okay, we are direct, but indirectly we have suffered the consequences of our actions and the inactions of the society. So we really need to take a look at. My son is not the only one who is diagnosed of asthma in recent times. When you go to our OPD right now for children, almost every 2 out of 10 children, the pediatricians are diagnosing asthma. And many of these asthma and allergic conjunctivitis and all, they don't have family history. So really and truly, there's something happening. And we need to get informed. We need to also get onto the platform and sign this treaty and make noise about this treaty so that something can be done about it. So I'll conclude soon by saying that we should be the change that we wish to see, in the words of Mahatma Gandhi. What can we do? Having these webinars is one of the most important, and I was very glad when I was contacted to share my knowledge and my experience as a healthcare worker. It's really important that we all get informed. Some of us do not know. Some of us do not know that the plastics that we are using every day are causing us a lot of harm. Growing up, we were buying food with our own bowls from home, many of whom were stainless steel that we used to buy our porridge and everything. But now in Ghana, everything, almost every food is served in a plastic, this single-use plastic, because people find it convenient. But if we begin to give them the knowledge so that they know that it's not only about convenience, but the risk that is having on our health, I think that is one of the things that we can do. So knowledge is power. Let's get people involved. And of course, let us join this plastics-free campaign. Let us, in our own small way, start small, and I know that we'll be getting somewhere. It is possible, that is what we are saying, that it is possible to avoid single-use plastics. Of course, when we get informed, we know the health risk of plastics. We also do our own bit to avoid the use or reduce the use of single-use plastics. Then we can also now continue and join the advocacy and rise against production and the usage of plastics. So on that note, I want to say thank you so much to the organizers of this webinar. Thank you for having me. Over.
Thank you, Dr. Awakia, for sharing your insights as a medical professional and really the shocking trends and diagnoses that you continue to see daily, and for sharing some of your personal stories there. I will hand over to our next speaker. There's great engagement in the chat, and hopefully we'll get to the speakers addressing some of those questions. I'm going to hand over to Ruth Stringer from Healthcare Without Harm, and she's going to really take us through what are the options and considerations for plastics-free healthcare that exist. She's going to share several case studies from global South cases that we can draw on from. Ruth, the floor is yours. Thank you.
All right. Thank you, everybody. Lovely. So, hello, everybody. My name is Ruth Stringer, and I'm a waste, plastics and chemicals expert with Healthcare Without Harm's global team. I'd like to thank our hosts for organising this excellent webinar and for the opportunity to join this illustrious panel. Today, as Afoko said, I'm going to focus on existing options for reducing plastics in healthcare, including drawing on examples in the Global South. Next slide, please. As you've already heard, a large proportion of healthcare waste, half to 3/4 of healthcare waste, can be plastic. However, profiles do vary in different settings. And so waste audits are a good way to understand plastic consumption and make sure that any actions being taken are right for the setting. The good news is that healthcare can reduce plastic consumption and save money by changing products and practices. And I want to be clear here that many of the single-use plastic products are not the route to better hygiene that many people think and that manufacturers promote them as. They are simply more convenient for management, as they don't need to worry so much about cleaning and disinfection processes. In fact, this actually undermines these vital aspects of hospital hygiene, which puts more people at risk. Action now can also save the global south from repeating a lot of the mistakes of richer countries, which spending huge amounts of money on disposable single-use plastic things, items like PPE. The UK just liquidated over £1 billion worth of unwanted PPE or inappropriate PPE that was bought during the first year of the COVID pandemic. And many medical textiles are now based on plastics instead of natural fibers. And it's important that these products are not allowed to invade new markets. Next slide, please. So this slide shows the wide variation in the amount of plastics in different healthcare facilities in the global south. I want to point out that if you're looking at audit data, be sure to know whether there are food waste is included or not, because that can be quite heavy and that can make quite a bit of a difference to the audit results. But from this slide, it's clear that many of the facilities that we've looked at haven't escaped the large increase in the use of plastics in healthcare. I want to dig a little bit deeper into the data from Asia. Very often waste surveys are based, the classifications are based on the hazard categories of the waste or how they need to be treated and disposed of. Instead, the survey that for the Philippines and Indonesia, which was carried out by friends of mine in Healthcare Without Harm Asia, was designed along the lines of the brand audits that Break Free from Plastics were doing around the coasts at the time. So waste items were categorized according to their original purpose, and they were both weighed and counted. Next slide, please. So this is the weight data for these 5 different hospitals in the Philippines and Indonesia. And we can see that the grey medical items and the green coloured sanitary items represented most of the plastic waste at these hospitals. Packaging, which is pink, comes next, followed by drinks bottles, blue, and foodware, which is orange. Plastics from toiletries and other sources only contributed a small proportion of the waste. So this does show that some of these hospitals haven't yet fallen prey to some of the worst excesses of single-use plastics. So they don't yet seem to have things like throwaway plates, knives and forks in their catering departments, which is great, but is very common in places like the USA. Another surprise, though, is that sanitary products, including diapers, which are really hard to dispose of, make up a surprisingly large proportion of the total waste. However, this may be different where you are, so it's worth doing an audit to identify the main problems in your location before starting action to reduce plastics. Next slide, please. Now, Healthcare Without Harm has 2 specific resources to help hospitals audit plastic waste. There are one published by Healthcare Without Harm Asia in 2019 and one by our European office in 2021. Each report has instructions on carrying out the audits, links to an Excel tool, and various policy advice and other information about the impacts of plastics in healthcare. But the 2 audits do have different structures, so it's worth checking each of them to see which would be the most useful for your audit. Also just worth noting that whereas the Excel sheets and the Asia report are in English, the EU report is also available in French, Dutch and Brazilian Portuguese. I know we probably have a lot of French speakers today, so the European report may be the most useful one for you. And also our global network of hospitals is free for any healthcare facility to join, and we're always looking for new case studies. So reach out if you have any audit data you'll want to share. Next slide, please. So once you have your data, the next step is to work out what to do about the problematic waste streams or the products that you've identified as being your top priorities. And the first priority across the board is always to reduce the consumption of plastic products. With some efficiency and a little bit of attention towards procedures, it's possible to reduce it in almost all categories. But then if you look in the right side of this table, we see products that we want to eliminate totally. This will be things like drinks bottles, disposable foodware, and so on. And that can be done with little impact on the actual healthcare environment. In the column on the left, we've got things like diapers and surgical gowns, eye shields, and oxygen masks. Often these are throwaway. Apologies. So the diapers, surgical gowns, eye masks, oxygen masks, and so on. For many of these, there are alternatives which exist, and we should be switching over to those and away from the single-use plastic versions. Any that are not yet reusable need to be redesigned for reuse. Many can be made of non-plastic materials, but if plastic is absolutely essential, at least they should be made with the least toxic and most recyclable materials available, so they don't cause downstream problems at the end of their useful lives. And then in the middle column, we have vital medical products. The products like syringes that will always be plastic and will always be single use. But even vital products like these can be overused. Many intravenous medications have oral alternatives, and if they were prescribed systematically, a lot of plastic use can be avoided. But these and other essential products need to be recycled or redesigned so they can be recycled. Syringes are already made of recyclable plastics, and our partners are already successfully recycling them. But other products like IV lines are almost always made out of PVC, which contains toxic additives and should never be recycled. These need to be redesigned with safer polymers. And there are options that we believe are going to be potentially safe. However, it's not, these IV systems are so complex that it's not easy for individual healthcare facilities to make a switch. And the industry is quite monolithic. So this is the sort of example where it's absolutely essential that the healthcare plastics are not exempt from the provisions of the healthcare treaty, the plastics treaty, because what we're going to need is international legislation to force these larger scale changes that are going to be necessary to protect human health. Next slide, please. And while we're on the subject of the plastics treaty, anyone that was attending INC4 will have seen these industry posters around the sites saying that plastics save lives, plastics protect you from food waste, plastics deliver water. This emotive imaging is part of the lobbying for the exemptions. And this oxygen mask in the picture is a single-use PVC item. Industry is also pushing projects to recycle them, but they're just greenwashing. These recycling projects are not viable economically, and they're not capable of making any sort of dent in the amount of PVC that's used in healthcare. Plus, of course, any recyclate will contain toxic phthalates, and so we'll be passing those hazards onto the new products that was made out of them. Next slide, please. So instead, we need to switch to options like silicone masks that are heat resistant and can be autoclaved and reused. In Cali in Colombia, Fundación Valle de Lili has been using these successfully for several years. And this is part of their ongoing activities to avoid PVC use. And the hospital's also undertaking other initiatives to improve their environmental impact, and reduce plastics consumption. Next slide, please. Staying in the Americas, the Provincial Health Services Authority in Canada targeted single-use disposable sleeves for sequential compression devices. These were causing a lot of waste and were expensive. So when a contract expired, they decided to purchase pumps and use reprocessed sleeves. The cost savings increased operational efficiencies, and environmental benefits have won over the skeptics. An average of 60,000 devices are being diverted from landfill every year, plus all the packaging for each of these devices. To make this change, they did have to buy new air pump machines, and this upfront investment was initially seen as a financial hurdle. But actually, if it was calculated into a long-term savings plan, these things can be overdone. The British Columbia Health Organization started realizing the financial benefits in 2023, and over 7 years, they estimate that they will save $6.3 million. Next slide, please. Coming home to the UK, which is where I'm based, staff at the Great Ormond Street Children's Hospital reduced their use of plastic gloves just through simply rethinking when they were necessary. And in the process, they saved 21 tons of plastics in just 1 year. Putting this in child-friendly units, that's 3.5 T-Rexes worth of plastic. The team used internal communication channels to raise awareness and developed a training package to reach all of their nursing staff and healthcare assistants. They also found a year later that people's hands were less red and chapped from the overuse of gloves, and some patients appreciated it too. There was no increase in hospital-acquired infections, but it also did have the side benefit for one young patient. Staff reported that they had a phone call from a father with a child at Gosh who had learning disabilities. And he explained that because people would often put on gloves before they did almost anything with his child, the child's phobia was stimulated by them. And the anxiety levels in his child had been lowered so much as the gloves were no longer there to stimulate his anxiety. Next slide, please. Back to the US. As an overall vision of the amount of impact this can have. So the US and Canada Healthcare Without Harm's Innovation Hub has more than 1,500 hospitals and health systems in the network and surveys members each year. 91% of hospitals that provided data have installed reusable fluid canister systems in their operating rooms. 82% have installed reusable sharps containers. Other member hospitals have made big strides in reducing disposable food serviceware, things like straws, and eliminating polystyrene. Next slide, please. We have a similar range of approaches being undertaken in the Global South. One Philippine hospital reduced single-use disposable plastics through a variety of initiatives, including banning polystyrene foam, simply saying that nobody was allowed to bring polystyrene burger cases and similar things into the hospital premises, and phasing them out from the kitchens, replacing cling film and other food wraps with hard plastic containers that could be reused, insisting that staff bring their own silverware and water containers so that the hospital canteen didn't have to have disposable ones, and recovering items like PET bottles and syringes for recycling. Next slide. Now, it's true that we cannot recycle our way to the plastics crisis, and I don't want to counteract that really important message. But there are applications where it can be the best solution. Our strategic partners, HECAF 360 in Nepal, have been supporting healthcare facilities to recycle syringes for over 15 years. And I've been lucky enough to work with them on some of these projects. Because the syringes are made of polyethylene and polypropylene, the recycling process is as sustainable as possible. Now, the steps are simple: to provide needle cutters at the point of use and segregate the cut syringes and packaging at the point of use. WHO research has proved that needle cutters don't pose any risk to the users, and in fact our surveys have found that around 20% of needle stick injuries happen during waste disposal, and that installing needle cutters can reduce these injuries almost to zero. It's also worth mentioning the downstream impacts, because Nepal is one of those countries where syringes are sought out by rag pickers, and they can either be sold for recycling, but more often they can be sold to criminals who will wash them out and resell them back to unwary customers. And these rag pickers can get 3, 4, or 5 needle stick injuries a day and have sky-high levels of hepatitis C as a result. So these needle cutters have significant health impacts, positive ones. So next, the cut syringes are autoclaved to remove any risk of infection. And for this, we use aluminium containers that are made locally. And they're there just in case, I mean, they're very convenient to use, but they also protect users from any stray needles. And in case a facility doesn't have an autoclave, these are lockable, and they're very useful ways of transporting syringes. And then, because what we have here is a clean and consistent waste stream of high quality plastic, the recyclers are prepared to pay a high price of around 20 to 25 US cents per kilo. And this is one of the highest value recyclates that the hospitals produce. And so it's worth remembering this. Other speakers have pointed out how much post-consumer plastics are not recycled. But in healthcare, where you've got a professional and highly organized environment, it can be possible to get safe recyclate and high quality recyclate out, as long as it's the correct polymers and they don't contain any hazardous additives. Next slide, please. So before I end, I want to give a special medical to medical textiles. Single-use plastic-based textiles have squeezed out a lot of traditional textiles in high-income countries, and we need to be careful that the trend doesn't catch on elsewhere. And this is an important example of where there's a myth that single-use is safer, but in fact it's not, plus it's a lot more wasteful and expensive. The UCLA Medical Center in the US began a reusable isolation gown project in 2012, starting with a liver transplant unit that was using 1,000 disposal isolation gowns a day. During a 6-month trial period, the new gown design was finalized and rolled out. The new gowns offered more comfort and better protection compared to their disposable versions, and could be laundered and reused 75 to 100 times. The center saved more than $1 million and diverted hundreds of tons of waste. Next slide. So these plastic-based fabrics are also the basis of a lot of personal protective equipment, including surgical masks. But in the Philippines, by customizing their PPE to be washable, St. Paul's Hospital in Cavite in the Philippines was able to save tens of millions of pesos in a matter of months. From April to December in 2020, at the height of the COVID pandemic, when so many people were struggling to buy this throwaway PPE, St. Paul's saved 65 million pesos from dispensing with disposable PPE. That's over $1 million. They also reduced their waste expenses by 33% through recycling between January and November of the same year. The St. Paul's hospitals have been a beacon for sustainable healthcare in the Philippines, taking on multiple initiatives over the years. And the head of Healthcare Without Harm Asia, Ramon San Pascual, says that they realized early on that there's far too much use of plastics, and they're also paying so much for hauling and disposal, which is causing harm to the environment. Next slide, please. So, Healthcare Without Harm is currently working on a project to reduce plastic-based medical textiles and replace them with more sustainable, reusable options. That's going to include new tools and resources, including training materials. We'll be releasing these in the coming months with a final report in early 2026. So please do look out for those. In the meantime, you can find more resources on plastics in healthcare at these locations and from our strategic partners at GroundWork. Thank you very much.
Thank you very much, Ruth, for your presentation, really showcasing healthcare plastics reduction activities, but also the aspect of them being evidence-based is quite clear. So thank you for that. I'm going to hand over to our last speaker for today. John Chweya is joining us from Kenya. He will be giving us waste picker perspectives on the health impacts of plastics. John, over to you.
Thank you very much. First, I'm really sorry for joining a bit late. I had a situation that I had to handle. But then again, I would like to bring a bit more of some lived experiences with plastic, because for a better part of my life, I've been dealing directly with plastic, but also having and seeing and having to experience some of the effects of plastic around where we work. And because generally waste pickers are working and living in plastic in 24/7. We have some of my colleagues that are still working and living in the landfills. And if by any chance you've been privileged to see a landfill in Kenya or Dandora dam site, you'll notice that there's heaps of organic waste mixed with single-use plastic that is always burning. So some of the lived experiences that I would also like to bring on board, and also to try to highlight on the health perspective, is that we do feel the effects of being around waste. We do see some of the effects of plastic, because I've personally seen like a very good number of my colleagues, just because of the reason of handling plastic and always like inhaling burning plastic. Because one thing that I've come to learn is that when plastic is burning, it goes back to, I believe, to its original state. And as the last speaker also mentioned, something about the polymers is that we are exposed to these polymers without exactly knowing which exact polymers are there and what effects they have into our bodies and our lives. We just see them manifesting in form of different health diseases. We see them manifesting in scenarios or in symptoms that are more like cancerous. And these are some of the things that as waste pickers, we get very much challenged by, because our bodies and our lives are at the very heart of the effects of some of the things that we receive, because we deal, like most of us deal 24/7 handling these particular plastics. We also not just entirely handle plastic, but also handle waste in general. So there's that aspect of the effects of waste. But then again, the most important part, and that which I've been very much keen on to try to address, is the effects of what we are encountering with plastic. Because this is something that has been happening a lot in Kenya. We've had several situations of dam fires, and even when these fires normally occur, it's normally plastic that is burning. We see plastic burning every day. But apart from the incidences where fire has raged, like some of the makeshift structures that waste pickers also take as their shelter within the vicinity of the landfills, there's always that 24-hour breathing in, inhaling smoke that is always there, burning. And I think one thing that I would very much like to address is that where speakers are bringing on board like lived experiences, where speakers have seen these impacts. And this is not something that most of our institutions or our governments want to talk about, because we see the impacts manifesting in us. We see a lot of medical symptoms that are there and are so bad. We are not very much in a position. We are not very much privileged to be in any position to afford medical screening that can particularly identify that this is either cancer or this is pneumonia or this is, most of us are normally in a situation where we have to choose between like trying to afford medical care or trying to afford food, or maybe trying to afford shelter, or trying to get our children to school. And when we are shifting our focus onto these other basic needs, we normally like say that we are resilient. We are resilient to some of the impacts of plastic and waste in general to our bodies. And this is something that I think it's very important for us to also bring on board. And this is something that we've also been very much trying to have it incorporated in the not only the global but also the very local treaties, because this is a very grassroots challenge that we are facing and that we need to address from a very grassroots level to a global platform. We are bringing on board lived experiences. We are bringing on board realities of what is actually happening to us. We've experienced lots of like even hormonal changes because of just the environment which we live in. And I believe that the levels of pollution that waste speakers particularly are exposed to is something that should and with like quick response be solved. And some of the things that we've been saying, and just like the resolution to end plastic pollution was already made, is that when all of this ends, because there's also a lot of from my landfill, I've come to learn that there's also a lot of lies that either industries and governments are not saying, because sometimes we say that this plastic is banned, but it could not be very easily seen in our communities or our environments. But at the landfill, we receive it because no one wants waste behind their backyard. So most of it actually normally comes to the landfill, or if it does not find its way to the streams or the lakes, it comes to the landfill. And we see, and we also know how much there's a lot of lies from industries about the recyclability of some plastic, yet no one wants to take them back. And the moment that it is visible that no one wants to take it back, it means that it's not recyclable in any way. It has no value. And that is also another big problem, because it keeps on adding more and more of plastic. And especially from our end, we are not very much privileged to know exactly what polymers are in these plastics. I've personally seen like plastic burning and like directly choking some of my colleagues that were working right beside it. And we normally know that plastic is different by the polymers, especially when they burn. And that is why I was initially mentioning that whenever plastic is burning, it goes back to its original state, and its original state is very toxic. And this is something that we've been manifesting with our bodies, because we experience and we are like literally living with this exposure to toxicity. So I wanted to bring a bit of lived experiences of what is actually happening, because there's a lot of things that, especially on pollution and waste, that is happening on the worlds of waste speakers and where we work and live, that is not very much being talked about, that is not very much on social media or media in general, or even mainstream, that is not very well articulated in these treaty negotiations. And these are some of the things that we're trying to bring on board. We know that as also some of the policies within our communities are being discussed. Like right now, there had been a very big discussion about erecting an incinerator in Dandora Dam site, and we all know that already we are experiencing and seeing how much like the smoke of plastic burning has affected some of us. And this is now like the government coming to us and telling us that they're going to bring a very big chimney that is going to now burn even in bigger volumes, and tell us that it's not going to in any way affect us. That is like a very big lie, an open lie. And I believe that some of these policies are like designed. They're designed, and their foundation is on lies, so that other institutions or other firms can benefit from them, because they already are profiting heavily from them. And these are some of the things that we see. We fight them, but it's so easy for me to see that whatever is in the news is being said that is not there, is there, because it still comes and comes. So thank you very much for listening, and I just wanted to bring a bit of the lived experiences of waste speakers on this webinar. Thank you.
Thank you, John, for pulling through. I know you had challenges joining us. Thank you for sharing the lived experiences of yourself and your colleagues. Really unfortunate experiences there at the Dandora landfill site. Thank you for joining us. I'm going to hand over to Marissa to lead our question and answer session, but I'd like to thank all the speakers for their insightful presentations today. Marissa, over to you.
Thank you so much, Mafoko, for expertly facilitating this session. It's been almost a full 2 hours now, and I just want to once again recognize all of our speakers and just say thank you once again for all of the insights that you were able to share. I believe it was a really diverse insights that we got to hear, whether it was from John, and his lived experiences, or Ruth being part of healthcare without harm, and Dr. Victoria as a healthcare professional. So I just want to really, before we go into a bit of a Q&A, and I do know that we are a little bit over time, but if you will bear with us, we will take a few questions, and I'm going to try and combine some of the questions just so we can get a holistic picture to close at the end. But I do want to emphasize that, this webinar was really organized by groups that are in favor of us focusing our efforts on plastic reduction. So the narrative that, plastic saves lives is in fact misguiding us to believe that we can continue on this path of overproduction. And what our speakers have done today is demonstrated that plastic in the healthcare sector is something that we can be shifting away. Now, whilst plastics may be a very sensitive issue and a very sensitive topic in the healthcare sector, there's a reason why we titled this webinar as Adjusting the Lens on Plastics and Healthcare, because we really wanted to prompt people to think about how the healthcare sector can actually reduce their reliance on plastics, especially single-use plastics, and that we cannot continue as business as usual. And that's why we're seeing a global plastics treaty come in place, is to be able to address some of this. And we do recognize that, plastics in Africa, in the healthcare sector specifically, is heavily relied upon because of a lack of alternatives or the like. But, as our speakers have demonstrated, starting with Aziza, Ruth, and Tracy, is that we can look to the Global South for successful cases of how they are actually reducing their plastic waste and their use of plastics in the healthcare sector. So yeah, I just really wanted to emphasize that and leave that all with you to think about as we move into our Q&A, and to really think about the fact that all of our speakers have shared views from a science perspective, and those views from a science perspective have to follow through when it comes to policy development. So just to sum it all up, maybe if I could combine the question from Melody and Aswati, who are basically asking, and I think Aziza and Ruth, perhaps you could tackle this one. But both of them are basically trying to get a better understanding of how waste minimization can come about in the healthcare sector, and what strategies you could recommend for considering, hygiene and well-being of patients and healthcare providers. So what are some of the ideas you have about redesigning the way plastics are used in the healthcare sector? And I think both of them, if I understand correctly, the thought line is around the same. So perhaps we could tackle those two questions in one go. Aziza, and perhaps then Ruth could shed light on this.
Thank you. Yeah, I think the question was asked before Ruth's presentation, which actually outlined quite well how where we can reduce, where we can I think that extended producer responsibility is also important, looking at what you procure, your sustainable procurement. When you do your plastic audits, you'll notice how much wastage there is. Like, I don't know what that kit is called, but these kits, for example, for cataract eye surgery that has plastics, it's a whole kit, and then you only end up using 2 items from the entire kit and discarding the rest. So there's a lot of waste that doesn't necessarily compromise patient quality care at all. And then, looking at things like reusable hospital gowns where possible, looking at your fabrics, I think the textiles is important. There's plenty of low-hanging fruits. And then also just your waste characterization to try and see what can be diverted away from incineration, into like recycling. But obviously we're looking at using more than that. But I hope that there's a quick answer, but we can also share resources.
Thank you so much, Aziza. Ruth, would you like to just come in a little bit on this?
Yeah, sure. And I want to also note that people have been pointing out that access to water and electricity are also a problem in a lot of African healthcare facilities, and that's part of the issue. And it absolutely is. So the World Health Organization and UNICEF have published this year a strategy document for the next 6 years on addressing this: water, sanitation, health, including waste and electricity. And so we need to fix these fundamental issues, making sure that healthcare providers have these basic services in place. But whereas if you don't have proper hygiene, you can't, if you're lacking resources at that level, you're not going to be able to rely on single-use plastics to protect your health, because you're not going to have the resources to do that, the financial resources. And should there be any crunch, like in COVID, when PPE was available only to the people that had the most money and the most clout, then that will fall apart as well. So it's a whole system approach that really needs to be taken, and making sure that the resources are diverted to having a really solid fundamental structure for healthcare. Because we've pointed out in several of the case studies today, not just me but also other speakers, that the single-use solutions are more expensive.
Thank you so much, Ruth. And just to say that all of you are really the ones that are in the sector and would understand the solutions the best, and that's why we really relied upon you for bringing those perspectives into this discussion and into this webinar, so we can look at what are the realistic solutions that can be attained, when it comes to plastics in the healthcare sector. Folks, I do realize we are almost 5 minutes after time, and whilst there were a few more questions, we have noted them down, and we would be more than happy to get back to those respective people like Mariela and Abu Akbar, Abu Bakar, I think, back to you or via email, if that is okay. And just noting that to your request, Alexandra and Joanna, we have been able to link those references to Hectoria's presentation that you were looking for in the chat. So on that note, I'm going to kindly close off today's session, if that is okay with all of you. And just to say that we have recorded this session. We will be sharing the recording and all of the presentations with everyone that has registered for this webinar. And I hope that you all found it very insightful. And I just want to maybe go back to something that Tracy said in her presentation, is that we need to really address the plastics crisis with global policy, and that plastic pollution is ultimately a global health threat. So whilst we want to try and address pros and cons, the science is not showing us that production is actually positive, not for our health and neither for the environment and our ecosystems. So we thank all of our speakers for joining us today and for taking the time out of your day to really go through this 2-hour session for us. And we also really thank all of you for joining us, and a huge thank you to our team in the background for keeping the wheels turning. So thank you so much, everyone, and we will be in touch. Please stay tuned on all of our social media pages, GAIA Africa, as well as Healthcare Without Harm and GroundWork, that will be continuing to shed the light on plastics and healthcare in the month of Plastic Free July. Thank you so much.